Dr. Labos, we heard the health minister say, yeah, cases are on the rise, but they don't need to bring back other restrictions as of now, although he's urging people to stay vigilant and up to date on their vaccinations. Is that the right tack to take right now?
Well, it depends. It depends how you want to approach the situation. Everything they've said scientifically, or everything they said during the press conference scientifically was true. People need to get their vaccines. People need to wear a mask in public. What they haven't done is they said they're not going to put any type of official mandate in place. So they're basically asking people to do what's right, but they're not going to tell people to do those things. And again, we know whether you agree or disagree with that, I think to a large extent it depends on your political and personal leanings. Scientifically, though, regardless of what the government says or regardless of what laws are in place, if you don't want to catch COVID, the best thing you could do is update your vaccination status. So make sure you got your third dose or fourth dose if you're a high risk person. And, wear a mask in public. I mean, wearing a mask in public doesn't cost you anything. So if you're going to be indoors with a bunch of other people breathing the same air for an extended period of time, I don't see why you wouldn't want to wear a mask because it is a low risk, high yield way to prevent infections, regardless of what laws are actually in place.
Right, but Dr. Labos, as you are well aware and you mentioned, it's become politicized to some extent. And it's also, there's some peer pressure in certain cases, right? Like some people feel awkward if they're the only person wearing a mask wherever they are, right? And it's hard for people. Yeah. If there's a mandate and you have to wear one, we all fall under the same umbrella. But if it's left up to personal choice, it's difficult for some people.
That is very true. And as somebody who gets openly mocked when I'm wearing a mask in public,
really?
I will tell you that there is a lot. Oh my goodness, yes. People come up to me and laugh in my face and say, aha, you're scared of COVID. And my answer to them is, yeah, I am scared of COVID.
And then you tell them you're a doctor, right? And you tell them you're a doctor.
But here's the thing: the number of people that I see, because end up getting referred a lot of them who have long COVID symptoms, like previously young, healthy people that are now debilitated because they have palpitations and are short of breath, and there's nothing physically wrong with them. We've become a little bit obsessed with the mortality statistics, and that obviously matters because a lot of people died during the Omicron wave. But a lot of people survive COVID and are left with these long-term symptoms that we just can't do anything about. And that is a problem. If we continuously allow COVID to just infect large swaths of the population, we are going to have a huge number of people left with debilitating symptoms, and that's going to make it hard for society to function. When we talk about living with COVID, we're not going to be able to live with COVID if everybody is sick. I mean, we're starting to see the implications of that now with hospital staff off sick, the airports and the airlines having trouble finding staff to make things function. COVID is going to cause disruptions to the way our society functions unless we get it under control. And the things that get it under control are very basic things. We know how to fight COVID. We've done it before. We just have to keep doing it. The problem is that we largely stopped.